During a cardiac arrest, the most reliable indicator of effective chest compressions is A. A palpable carotid pulse during compressions. B. Visible chest movement. C. Color change of the skin. D. Presence of a spontaneous cough. Answer: A. Feeling a pulse during compressions confirms adequate circulation pressure is being generated by CPR. The first step after identifying an unresponsive adult with no breathing or pulse is to A. Begin rescue breathing. B. Check for medical alert jewelry. C. Attach the AED and follow prompts. D. Start chest compressions immediately. Answer: D. High-quality CPR should be started immediately to maintain perfusion until defibrillation or advanced care is available. What is the compression-to-ventilation ratio for adult CPR with 2 rescuers? A. 15:2. B. 30:2. C. 5:1. D. 20:2. Answer: B. For adults, the compression-to-ventilation ratio remains 30:2 regardless of the number of rescuers. Which medication is used as the first-line treatment for pulseless ventricular tachycardia or ventricular fibrillation? A. Atropine. B. Amiodarone. C. Epinephrine. D. Lidocaine. Answer: C. Epinephrine 1 mg 4/IO every 3 to 5 minutes is administered first to increase perfusion during resuscitation. After delivering a shock with an AED, the rescuer should A. Check for pulse immediately. B. Resume chest compressions without delay. C. Wait for rhythm stabilization. D. Deliver 2 breaths before continuing. Answer: B. CPR should resume immediately after the shock to maximize perfusion and improve the chance of return of spontaneous circulation, ROSC. What is the recommended compression depth for adult CPR? A. At least 1 inch. B. At least 2 inches, 5 centimeters. C. 3 inches. D. Less than 1 inch. Answer: B. Compressions should be at least 2 inches deep but not more than 2.4 inches to ensure effective blood flow. Which rhythm requires immediate defibrillation? A. Asystole. B. Pulseless electrical activity. C. Ventricular fibrillation. D. Sinus tachycardia. Answer: C. Defibrillation is the only effective treatment for VF and pulseless VT to reset the heart's electrical activity. In ACLS, how often should rescuers rotate during compressions to avoid fatigue? A. Every minute. B. Every 2 minutes. C. Every 5 minutes. D. When the team leader instructs. Answer: B. Rotating every 2 minutes helps maintain compression quality as rescuers fatigue quickly. Which drug is indicated for symptomatic bradycardia? A. Amiodarone. B. Epinephrine. C. Adenosine. D. Atropine. Answer: D. Atropine 1 mg for every 3 to 5 minutes, max 3 mg, is the first-line treatment for symptomatic bradycardia. When using a bag valve mask, BVM, with an advanced airway in place, the correct ventilation rate is A. 1 breath every 3 seconds. B. 1 breath every 6 seconds. C. 1 breath every 10 seconds. D. 2 breaths every 15 seconds. Answer: B. With an advanced airway, continuous compressions are given with 1 ventilation every 6 seconds, 10 per minute. In a patient with suspected stroke, the primary assessment goal is to A. Identify the time of symptom onset. B. Measure heart rate. C. Check for chest pain. D. Administer aspirin. Answer: A. Determining the time symptoms began is essential to decide eligibility for thrombolytic therapy. A patient develops pulseless ventricular tachycardia. After 1 shock and 2 minutes of CPR, the rhythm remains the same. The next step is to A. Administer epinephrine 1 mg for B. Deliver another shock immediately. C. Check for pulse. D. Start fluids. Answer, A. After the first shock, epinephrine is given to improve perfusion pressure before additional shocks. Which intervention takes priority immediately after ROSC? A. Checking for bleeding. B. Managing airway and oxygenation. C. Giving another shock. D. Starting chest compressions again. Answer, B. Once ROSC is achieved, maintaining airway and oxygenation is critical to prevent hypoxia and recurrence of arrest. What is the recommended compression rate for adult CPR? A. 80 to 100 per minute. B. 60 to 80 per minute. C. 140 to 160 per minute. D. 100 to 120 per minute. Answer, D. Compressing at a rate of 100 to 120 per minute ensures adequate circulation without causing fatigue too quickly. During a cardiac arrest, the EtCO2, end-tidal CO2, suddenly rises to 40 mm of mercury. This indicates A. Ineffective compressions. B. Possible ROSC. C. Airway obstruction. D. Equipment malfunction. Answer, B. A sudden rise in EtCO2 is an early sign of spontaneous circulation returning. For a patient in narrow complex supraventricular tachycardia, SVT, the first medication to administer is A. Lidocaine. B. Amiodarone. C. Adenosine. D. Atropine. Answer, C. Adenosine 6 mg 4 push is the first drug for stable SVT, followed by 12 mg if needed. A patient with asystole is being treated. The next action should be to A. Perform defibrillation. B. Stop CPR and reassess rhythm. C. Administer adenosine. D. Continue CPR and give epinephrine. Answer, D. Asystole is non-shockable, CPR and epinephrine every 3 to 5 minutes are indicated. The primary purpose of defibrillation is to A. Restart the heart directly. B. Stop chaotic electrical activity so normal rhythm can resume. C. Increase heart rate. D. Provide energy for contraction. Answer, B. Defibrillation halts disorganized electrical activity, allowing the SA node to re-establish normal rhythm. In ACLS, synchronized cardioversion is used for A. Ventricular fibrillation. B. Asystole. C. Unstable tachycardia with a pulse. D. Pulseless ventricular tachycardia. Answer, C. Synchronized cardioversion is used when the patient has a pulse but unstable tachycardia. In post-cardiac arrest care, the target oxygen saturation, SpO2, is A. 80 to 85%. B. 90 to 94%. C. 70 to 75%. D. 95 to 100% always. Answer, B. Maintaining SpO2 between 90 to 94% avoids both hypoxia and oxygen toxicity. A patient in pulseless electrical activity, PEA, should receive A. Immediate defibrillation. B. CPR and epinephrine. C. Atropine. D. Adenosine. Answer, B. PEA is treated with high-quality CPR and epinephrine since the rhythm is not shockable. During resuscitation, the team leader should A. Assign clear roles and responsibilities. B. Perform all tasks personally. C. Avoid communication. D. Focus only on chest compressions. Answer, A. Effective leadership requires task delegation, clear commands, and team coordination. What is the initial energy dose for defibrillating an adult in VF using a biphasic defibrillator? A. 50 J. B. 120 to 200 J. C. 300 J. D. 400 J. Answer, B. The first shock should be 120 to 200 joules depending on the manufacturer's recommendation. What is the maximum cumulative dose of amiodarone during cardiac arrest? A. 150 mg. B. 300 mg. C. 450 mg. D. 900 mg. Answer, C. Amiodarone 300 mg 4/IO is followed by 150 mg dose if needed, totaling 450 mg. Which rhythm does not require defibrillation? A. Ventricular fibrillation. B. Pulseless ventricular tachycardia. C. Asystole. D. Polymorphic VT. Answer, C. Asystole is a flatline rhythm, defibrillation is ineffective, and focus should remain on CPR and medications.